Hello, my name is Alyssa Miles and I will be conducting the clinical bedside exam today. But first, I would like to explain each aspect of the exam and what I will be looking for. The four aspects of the clinical bedside exam are to review the charts and case history of the client, conduct basic observation, conduct a cranial nerve and oral mechanism exam, and elicit trial swallows. First, I will review the client's case history and charts. By doing this, you're looking for the current medical diagnosis and history of any dysphagia, the family's medical history, the patient's current signs and symptoms, the current nutritional status, whether that be oral or by a feeding tube, and the respiratory status, whether they've had any recent pneumonia, tracheostomy tubes, or history of mechanical ventilation or intubation. By reviewing this information, it will give me a better understanding of the client's current swallowing function and what to expect when conducting the cranial nerve exam, oral mechanism exam, and the trial swallows. Once the client's case history and chart has been reviewed, the clinician can continue with the bedside exam. The first step would be to make a basic observation of the client. I would be looking for the level of alertness and mental state to see if the client is aware of the time, day, and date and orientation, the position in the bed to determine how the client is currently being positioned during the day and during feeding, the nutritional status to determine what level of food the client is consuming, the respiratory pattern and O2 saturation to determine if there is any signs of apnea during the swallow or any irregular respiratory patterns. These observations must be conducted first to ensure that the client is able to continue with bedside examination. Once the basic observations have been made and the client is clear to continue with the exam, I will begin to conduct a cranial nerve and oral mechanism exam. The cranial nerves 5, 7, 9, 10, 11, and 12 are used throughout each stage of the swallow and should be examined. After the basic observations have been made, I will then examine the oral cavity. This includes looking for any lesions, odd coloring, and issues with dentation such as missing teeth. Any issues in the oral cavity could result in the client's inability to masticate efficiently or cause the client pain during the swallowing process. After the oral cavity has been examined, we will then move on to the mandible. This assesses cranial nerve 5. To assess the function of this nerve, I must look at the symmetry of the mandible on extension by having the client open and close their mouth. I will be looking to see if there is any weakness or asymmetry of the mandible that would result in difficulties biting down on food into smaller pieces to be swallowed, mastication, and difficulty with buccal tension. Next, I will assess the lips by examining cranial nerve 7. I will look at the client's lips at rest, retracted by having the client smile, protruded by having the clients pucker their lips. I will then have the client engage in non-speech coordination by having the client make repetitive movements and alternating movements with the lips, as well as speech coordination by having the client produce the phoneme p and w in a repetitive pattern and alternating from p and then w. I will be looking to see if there's any weakness on either side of the lips, weakness in retraction or protrusion, and any incoordination in non-speech or speech movements. This could result in reduced labial seal, leakage of food or liquid from the lips, inability to transfer food from the utensil to the mouth, and incoordination of the swallow. After the lips have been assessed, we may move on to the tongue. First, I will look at the tongue's function to assess cranial nerve 12. I will look at the client's tongue movement both anteriorly and posteriorly. The client will protrude the tongue outward, lateralize the tongue side to side, and elevate the tip and back of the tongue up and down. Weakness or incoordination in any of these movements could result in a delayed swallow, lack of A and P movement, inability to form a bolus, and pocketing of food in the anterior and lateral sulci. Next, the tongue strength will be addressed. This begins with the client pushing laterally and anteriorly against the tongue depressor. The client will then push the tip and back of the tongue, both through elevation and depression, against the tongue depressor. Weakness on one or both sides can result in lack of A and P movement, inability to form a bolus, pharyngeal residue, lack of pressure to propel bolus, and the inability to trigger a pharyngeal swallow. Finally, the tongue coordination will be assessed. This begins with the client licking around their lips on all parts. The client will then produce alveolar and velar sounds such as ta and ka. Incoordination of these tasks can result in incoordination of the pharyngeal swallow, the inability to form a bolus, and the inability to sweep food from the anterior and lateral sulci. Once the tongue has been assessed, we can move on to the hard palate. This will examine cranial nerves 9, 10, and 11. The client will be asked to produce an ah for several seconds. Then the client will be asked to produce an ah several times. Lack of elevation of the palate may result in the inability to create pressure to propel the bolus downward. Once the examination of the structures has been made, the client's reflexes will be assessed to examine cranial nerves 9, 10, and 11. I will first elicit a gag reflex from the client by inserting a tongue depressor into their mouth towards the back of the throat. The client will also be asked to swallow and cough. Discrepancies with any of these reflexes could result in aspiration, penetration, and residue both unilaterally and bilaterally in the larynx. Once the cranial nerve exam and the oral mechanism exam have been complete, the client will engage in a series of trial swallows. The trial swallows will change in consistency to determine what textures the client is capable of swallowing efficiently. The 4 textures I have brought are water, smoothie, yogurt, and a cracker. I am looking for any residue in the mouth, drooling, gagging, coughing before and after the swallow, change of color in the face, leakage of food or liquid out of the mouth, pocketing in the anterior and lateral sulci, lack of bolus formation, abnormal transit time, and long periods of apnea. However, I must consider that the clinical bedside exam limits my ability to only see the oral prep and parts of the oral phase. Now that I have explained each aspect of the clinical bedside swallowing exam, I will give a live example.
The basic observations. I will be looking at Amy's level of alertness, her positioning in her bed, her respiratory status, and her nutritional status. Hi Amy, my name's Alyssa. How are you doing today?
Good.
Good. Do you have any questions for me before we begin?
Nope.
Okay. So I'm going to ask you a few questions before we start the exams. What is the date today?
November 28th.
And where are you at right now?
My house.
Very good. The next part of the clinical bedside exam is the cranial nerve exam and the oral mech exam. Okay, Amy, first we're going to be looking at your oral cavity. So I need you to open your mouth wide. And I'm going to use this flashlight to look inside. Right now I'm looking for any lesions in her mouth, any discoloring or odd coloring, and any issues with her dentation, such as missing teeth. Very good. Okay, Amy, now we're going to be looking at your jaw. I need you to turn to your right and turn to your left and open your mouth real wide and then close it for me. So through this part, we're looking at the symmetry of her jaw to be sure she can open and close it. But with this, we're looking to see if there's any weakness on either side, which could result in difficulty masticating and difficulty with buccal tension. Now I'll be assessing your lips, so I just need you to smile for me, and then pucker your lips, and then alternate between smiling and puckering. Nice job. Okay, now I need you to say the phoneme p for me. Now I need you to repeat the phoneme p. Very good. Now I need you to repeat the phoneme w. W. Now I need you to repeat it for me. W, w, w.
Wah, wah, wah.
Nice job. Now I need you to alternate back and forth between the p phoneme and the w phoneme. Now we'll be assessing Amy's tongue function. So Amy, I need you to stick your tongue out. And then I need you to move your tongue to both sides of your mouth like this. Very good. Okay, now I need you to move the tongue tip up and down. Very good. I need you to move the back of your tongue up against your soft palate and down. Very good job. So by addressing her tongue function, I'm able to see if she has the ability to make an A and P movement, to see if she's able to form a bolus, or if she's able to trigger a pharyngeal swallow. Now we'll be assessing Amy's tongue strength. So I'm going to place this on your tongue, and I want you to press against it as hard as you can. Good. I'm going to place it under your tongue, and I want you to press your tongue against it as hard as you can. Nice job. I'm going to place it on the side of your tongue, press as hard as you can. Good. And the other side of your tongue, press as hard as you can. Good. By addressing tongue strength, we're able to see if she has the ability to make an A and P movement, if she's able to keep from pocketing her food, and if she's able to form a bolus to be able to propel it downward. So now we're looking at Amy's coordination of her tongue. I need you to take your tongue and lick all the way around your lips like this. Nice job. Okay. Now I need you to say the sounds ta and ka and alternate those for me.
Ta, ka, ta, ka, ta, ka.
Nice job. Any kind of incoordination that you would have with the tongue would result in the inability to form a bolus, a delayed pharyngeal swallow, or the inability to clear food from the lateral and anterior sulci. Now we're going to be assessing Amy's soft palate. So Amy, I need you to say the sound ah for several seconds with your mouth real wide open.
Ah.
Very good. Now I need you to say the sound ah, 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 ah.
Ah, 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 ah.
Very good. We're looking for elevation of the palate here. If she doesn't have the ability to elevate her palate, then she might have a problem with the swallow, a delayed pharyngeal swallow, or it might result in a late transit time. Next, we're going to be assessing Amy's reflexes. So Amy, I'm going to take this tongue depressor and I'm going to place it in your mouth toward the back of your throat to elicit a gag reflex, okay? Now I just need you to swallow for me. Very good. And I need you to cough for me. Very good. So a lack of reflexes could result in aspiration, penetration, or residue unilaterally or bilaterally in the larynx. This part of the clinical bedside exam is the trial swallows. So Amy, I'm going to introduce you to 4 liquids and solids, and I want you to swallow them to the best of your ability. So the first one that we have is just water.
Okay.
Very good. Cool. The next one that we have is a smoothie. Very good. Our next will be yogurt. Feed yourself.
Ready to go.
You just take 2 bites. Very good. And our last is a cracker. So during the trial swallows, you'll be looking for any kind of gagging, drooling, change of color in the face, any residue coming and staying in their mouth, any leakage out of their mouth of the food or liquid, and any kind of struggle that you notice that the client is having. Either you can see it through their throat or on their face, which could indicate some kind of swallowing disorder.